In March 2013, Douglas County received a grant from Tri-County Health Department. It is a 3-year grant that is to be used to update district policies and to build awareness around the dangers of tobacco. The goal of today's webinar is to show you the current picture of youth tobacco use, specifically in Colorado and Tri-County. This grant is funded through the Amendment 35 tobacco tax from 2004. Tri-County and Douglas County are part of a statewide initiative. Local health departments and community organizations across the state have been funded to promote tobacco-free policies, reduce youth initiation, and increase cessation. We have made policy changes as we know this is an evidence base to reduce the youth initiation of tobacco, protect from secondhand smoke, and also establishing social norms that most people do not smoke. Let's take a look at the current tobacco picture. How many deaths in Colorado each year are due to tobacco use? Approximately 4,390 tobacco-related deaths occur in Colorado each year. Nationwide, the total reported tobacco-related deaths is roughly 443,000. In comparison, Colorado's numbers is roughly 1% of the nationwide total. Colorado is actively attempting to curb tobacco use among its residents. Colorado lists tobacco as one of its 10 winnable battles and has a goal to decrease the percentage of high school students' tobacco use to 16% by 2016. Why are these numbers significant? Because tobacco companies need replacements for their dying loyal customers. What is the best target population for big tobacco? Youth and young adults. Documents from the Master Settlement Agreement in 1998 indicate that tobacco industry has targeted youth as early as 1981, maybe even before then, but it's not documented. According to the FDA, approximately 3,600 kids under 18 years of age smoke their first cigarettes each day in the U.S., and an estimated 900 kids become daily cigarette smokers. That's 1/4 of the population. Unfortunately, many of these kids will become addicts before they are even old enough to understand the risks. In Colorado, about 5,300 kids become regular smokers each year. Tobacco annually claims about 4,300 lives and costs the state more than $1.3 billion in healthcare bills. Given their developmental stage, adolescents and young adults are uniquely susceptible to social and environmental influences to use tobacco. In the 2012 U.S. Surgeon General report, adolescents are valuable targets for the tobacco industry because they are more sensitive to nicotine's toxic effects, more susceptible to peer pressure, and more likely to respond to tobacco discounts. According to the U.S. Surgeon General's report in 2012 and the Center for Disease and Control and Prevention in 2007, 80 to 90% of adult smokers report smoking before the age of 18. That's a good retention rate. According to the Campaign for Tobacco-Free Kids, tobacco industry spends about $113 million a year to market their product in Colorado. In comparison to current 2013 funding, that amount is 5 times what the state spends on tobacco prevention and cessation. This is a bar graph depicting middle and high school students ever trying smoking. So in other words, these kids admitted to trying smoking at some point in their young lives. This is probably underreported due to youth not answering honestly or being ashamed of admitted trying. Note that this graph reflects data for kids 6th to 12th grade. Also notice the decline in cigarette smoking for middle and high school students. We must be doing something right. What percentage of high school students in Tri-County have ever tried smoking even 1 or 2 puffs? 37% is a really high number. Nationwide, it's 44.7. This is exactly what the tobacco industry wants. They know that nicotine is addictive, and if they can get youth to at least try it once, they know that the retention rates are in their favor. If we can get kids to not smoke until the age of 18, most of them will never start smoking. And some states are now changing the legal smoking age to 19, such as Alaska and Alabama. New York recently changed their smoking age to 21. So how many high schoolers are currently smoking? 11% of high school students reported smoking on at least one day during the 30-day period before the survey. Things that we do need to be concerned about that were not reported are chewing tobacco, dissolvables, and even e-cigarettes. Although we are seeing a decrease in cigarette smoking in youth, recent articles actually predict that tobacco use among youth is making a comeback through non-cigarette and smokeless tobacco use. In 2010, 6.3% of high school students reported using smokeless tobacco. I'm going to guess that there is a significant increase in that percentage due to popularity of e-cigarettes and dissolvables. Hi, I'm Cynthia Redfern. I'm the Tobacco Grant Coordinator for Douglas County Schools. I've created this Moodle for any community member who would like to learn more about tobacco and also to show you what Douglas County School District is doing about reducing tobacco use in the community. Thanks for watching.